Thank you, Quint. I am so honored and proud to be part of this year's Gratitude Symposium, a way to give back to all of our healthcare heroes who have given so much over the past 2 years. Bethesda Inc.'s journey began 100 years ago when 7 German deaconesses left their cottage in Cincinnati and went out to serve the poor and the forgotten, German immigrants who were struggling to make it in this country and needed care. Bethesda Inc. is proud to continue this legacy today by partnering with our healthcare system, TriHealth, to advance population health for all and to strive towards health equity through our grant-making initiative, BI3. I am most proud of the fact that 200 babies, 7 classrooms of kids, are alive today because of the collective efforts we've fueled to reduce infant mortality and the disparity we see between white and black babies. During this presentation, I will share what is health equity, why we should care about it, and how we can start to strive towards a day where everyone can achieve their best health. Today, I'm not here to persuade you to think a particular thing. I just want to inspire you, healthcare systems, and communities to think differently, to come together in new ways, and strive towards a day where health equity offers the opportunity for everyone to be as healthy as possible. What is health equity? I'd like to start first by sharing the difference between equality, equity, and justice. Equality is where we give everybody the same thing. Equity is where we give everybody what they need to be on equal footing. And justice is where we remove the systematic barriers so that everyone is on the same playing field. Health equity is an outcome and a process. Health equity means that everybody has a fair and just opportunity to achieve their best health. This requires us to remove obstacles like poverty and discrimination and their consequences, including powerlessness and a lack of access to good jobs with fair pay, quality education and housing, safe environments, and access to health care. To achieve health equity, we have to address both the health inequities that drive health disparities. Health inequities are derived from the unequal distribution of social, economic, environmental, and healthcare resources. This unequal distribution leads to the health disparities we see, those differences in health based on race, ethnicity, gender, age, your geographic location, sexual orientation, religion. The list goes on. So let's talk about what makes up a person's health. When you think about your health equation, 20% is tied to healthcare delivery itself. Many people think of behaviors when we talk about health and whether someone is healthy or not. But those health behaviors are often driven by the socioeconomic factors, where one lives, works, plays, learns, and grows. And these key ingredients vary from zip code to zip code. Did you know that your zip code is a better predictor of your life expectancy than your genetic code? Let me give you an example of this. I'm going to compare 2 women who live 15 miles apart. When I was pregnant, I was excited to make my first OB-GYN appointment. After telling my husband, of course. I didn't worry about getting to my appointments. I drove to and from. Didn't worry if I had to leave work because I had an understanding employer. Until I got too uncomfortable at night. I slept soundly, not worrying about losing the roof over my head or my utilities being shut off. And when it came to delivery, I never once was concerned that my needs wouldn't be addressed or I wouldn't receive the top quality care that I deserved. But a Black woman who lives 15 miles away from me has an entirely different experience. She's afraid to go to that first prenatal appointment because of the discrimination she's faced in the past. She has to take 3 buses to get to her appointments to and from, and worries that if she has to go during the day, she may lose her job for having to leave. And at night, she doesn't sleep well because she's got an electrical issue in her home that her landlord won't fix, and she worries about her children at night. And last, she's nervous and scared when it comes to delivery day, that her concerns won't be heard, and that she won't receive the quality care that she needs and deserves. We can look no farther than Serena Williams to see how this plays out. So why should we care about health equity? I believe it's a human right. When you look at the infant mortality rate in the U.S., the rate is 5.9 per 1,000 lives. In 2018, that means 21,000 babies died in the U.S. When you start to break this down between race and ethnicity, you will see that Black babies die more than 2 times the rate of white babies in this country. Doesn't every baby deserve to be as healthy as possible? And cost. Most people care about cost and know that the health care costs in this country are skyrocketing. We spend one of the highest expenditures on health care, and yet we fall to the bottom in terms of health outcomes. An analysis by the W.K. Kellogg Foundation found that in 2018, they estimate that health disparities cost $93 billion in excess medical costs and approximately $42 billion in productivity losses. And because we see health disparities among our minority populations, it's important that we start to address this now, because by 2050, people of color will make up 52% of our population. So what can we do about this? How can we drive towards health equity? Where do we start? The Institute of Healthcare Improvement has developed a framework for improving health equity. It makes up of 5 different areas that a healthcare system and community can focus on. But the very first step is placing focus and emphasis on health equity, making it a strategic priority, core to your mission. Without this commitment and intentionality, the others won't achieve what you hope. We need to build the infrastructure to support health equity. This means investing significant resources in HR and data collection. TriHealth is training their team to ensure that we capture race, ethnicity, and preferred language. And our region is doing this also to ensure that we can start to aggregate health disparities as a community. One of the things I'm most proud of is the School to Work program that we started 2 years ago at TriHealth. It's opening the eyes of minority students to all the different opportunities and career opportunities in healthcare. It's also building our workforce pipeline to create a more diverse workforce that leads to better health outcomes. But don't take my word for it. Let's talk to the students.
When I graduate, I'll be going to UC. I want to study something in like math or the pharmacy, one of those two.
I want to go to college. I got accepted into UC recently. I want to go there for 4 years.
My plans after graduation is to attend UC main campus for criminal justice and minoring in psychology, and I hope to get a job in like registration over here at Good Sam.
It wasn't until I got into the School to Work program in Rochester that I realized healthcare is so much broader in a health system or even a hospital system. I know where I got my start from, and it was the School to Work program. So coming here, being blessed with the opportunity to partner with BI3 and with Mark Clement's support as our system CEO, given us the green light to say, let's create that program here and let's create a model for success that other health systems in this region and across the country can actually adopt, is just amazing.
With this program, there's a combination of benefits, some of which are exposure, experience, mentorship, but also being a part of this program is a little bit different because these students are moving from being students in the high school to actually being team members and being employed by the hospital.
When I first started this program, I wanted to be an OBGYN. I wanted to work with women and babies. Now I want to work in emergency medicine, so I completely changed my career choice for the future.
My dream job is a job in the finance department at a hospital.
We really love having all of the School to Work students. Really, they do so much for us. And since Mo has come back again and again, really she's had such an impact for us.
I would like to say the program is really helpful. You have people here that are willing to help you. You just got to build connections with them.
I would definitely recommend this program. Questions are very important. Let everybody know that you're interactive, that you're paying attention, and this is a learning experience. So you want to talk, you want to introduce yourself to different people. You never know where that's going to get you. That could get you a scholarship, a job.
I want to get them prepared. Even if they don't go to college, they're going to have 2 years of hospital experience, and that's going to give them the edge. I just want to make sure we have a strong impact on them wherever they go.
I think that is one of the most powerful, impactful things going on today. And it can start with something as simply as being a nurse's aide and developing into becoming an RN and developing to becoming a doctor. I think those things are powerful.
It is one of the strongest diversity, equity, and inclusion initiatives that I've seen. And we know that through the School to Work program, we take students from the community, we put them in a community hospital. We give them exposure, we give them the skills, we give them the tools, and help build their knowledge to one day be healthcare professionals and come back into those hospitals and come back to the community and treat those patients. We are doing exactly what we said we know needs to be done to be successful and build trust in healthcare. And we're building a very diverse pipeline of students and employees and team members who come back and serve our patients.
I am proud to report that over half of our first cohort are going to work part-time at TriHealth while they continue to further their education. We hope to build to 50 students per year, and we're creating a how-to manual that we hope you will take a look at as we encourage other healthcare systems to adopt similar programs. We can all work together to build a more diverse workforce. To eliminate racism and other forms of oppression, which is key to this framework, we're partnering with our community foundation to offer Racial Equity Matters that gives corporations, organizations, community leaders the opportunity to just learn more about structural racism and how it shows up. It starts with hearts and minds. It starts with me. It starts with you. Lean in and learn. We are also fueling implicit bias and cultural competency training at TriHealth. It's important to know that if you're human, you have implicit bias. You're a product of the society in which you were raised. But by training, we can start to recognize our implicit bias and pause, and then respond differently than we may have in the past. And it is working. We heard from a frequent flyer in the ED that thought we had hired a new staff because when he came in, it felt different and he was treated different. We are also sponsoring TriHealth to participate in IHI's Health Equity Learning and Action Network. They are one of 9 healthcare systems across the country in this program and the only one in the state of Ohio. In order to achieve health equity, we have to move beyond hospital walls and work in partnership with the community and listen to those with lived experience. We need to address the social determinants of health that make up 40% of a person's health equation. I want to share a success story here locally in Cincinnati. Cincinnati is home to leading healthcare systems, yet we had one of the highest infant mortality rates in the country, particularly in one Black neighborhood. But in 2020, we recorded the lowest infant mortality rate on record. How did we accomplish this? Where did we start? Nearly a decade ago, BI3 fueled an unprecedented collaboration between healthcare systems, nonprofit organizations, to look at the model of care and the silos that we had created. We engaged with moms. We listened to them about their fears and the social and economic barriers they faced that prevent them from really engaging in prenatal care, which is so important to reduce infant mortality. Based on these learnings, we developed a new model of care that puts mom and baby at the center and surrounds them with the social supports that they need to have a healthy pregnancy. I've invited my friend Jeremiah to talk with me from a healthcare perspective in terms of how we are building out this model within an OB-GYN center that serves a majority of women who are on Medicaid.
I am so excited to talk with my friend, my colleague, Jeremiah Kirkland. He is lead over women's services. He has really accelerated diversity, equity, and inclusion efforts here at TriHealth, and he was just named president of one of our hospitals. But above all that, he is a committed leader for change, and his passion drives others to action. Thanks for joining us today, Jeremiah. Welcome.
Thank you. Thank you, Jill. Thanks for having me.
Nationally, Black maternal mortality is 3 times greater than white mortality. And we find that Black women suffer from higher rates of medical errors, of heart issues, lack of proper care coordination. So can you share with us how you're looking at improving maternal health within women's services, especially for those women who face racial, social, and economic barriers?
Jill, great question, and I'm happy to share with you some of our approaches, clearly some of which we've partnered on, but first we start with the problem. Like you've outlined, this has been a significant issue, not just here in Cincinnati, but throughout our region and throughout the country. And one of the ways that we have said we are going to address it right here in Cincinnati is through approaching the problem head on and focusing on how do we, one, hear from the community, hear from these moms, listen to them, take into account things that we might not have addressed or heard before because we've relied on our own information to address the problem. The first step was going into the community, listening to mothers who have said, the reason why we're having some of these outcomes is because we don't feel heard by our providers. We do feel like racism has played a role or implicit bias has played a role in the care that we received, and we are not listened to by our clinical providers and our care team. We took that information and then said, you know what, let's look in the mirror. How can we as an organization understand that we need to help address some of these needs in caring for these moms prenatally and then in the postpartum phase. And we said as a team, we can only do but so much. You know, we can control certain interactions in care and certain episodes of care, but that's not the full picture of what the patient is living through. That patient leaves our health system, leaves our doors, and they go out and they go into an environment that has impact on their health. They go out and try to look at, what food they can purchase, their housing. All of these things play a role in the overall care for that woman and in the child, in the baby, in their health outcomes. So we have said in partnership with BI3, with our medical legal aid partnership, and with our partnership with other organizations throughout Cincinnati, how can we help address mom's needs across the board? How can we make sure she has appropriate housing, the electricity is turned on, that she's got the right access to food, and all of those social needs, and then also medical needs, behavioral health needs. How can we address those quickly? How can we work with the right partners to get mom the support she needs? And then make sure that she understands that we're partners in her care. So I think it's just been truly a collaboration, bringing the patient to the center, making sure we're listening appropriately, and then taking action through our partnerships.
So I'm going to ask you to expand a little bit upon that. Healthcare systems in the past have been somewhat siloed. And when we want to fix a problem, we think it's just easier to do it ourselves than in partnership with community-based organizations. So can you speak to the importance, and BI3 has fueled a lot of partnerships, like you mentioned, the Legal Aid Society and starting the Maternal Health Law Partnership at a high-volume OB-GYN center that helps reduce those health-harming legal needs for moms. I met Tamaya, who couldn't sleep at night because she had an electrical issue, and through Legal Aid, they were able to resolve that for her in 3 days, and she could get sleep while she's pregnant. So can you talk about some of the challenges, but also why it is so important for healthcare systems to work in partnership with the community and not get siloed?
It really has to do with how that patient is living outside of our walls. I think historically we have been siloed because it reminds me of the saying, if you want to go fast, go alone, right? And as a health system, if we want to make quick changes, let's just do this by ourselves. Let's spearhead this. Let's move forward. We have people within our hospitals and within our offices. Let's move fast. Let's go. And we essentially go alone when we're operating just as a health system. But if you want to go far, you go together, right? And if we want to go together, that means incorporating lots of people in the community and listening to our patients and then taking action, partnering with BI3, partnering with other institutions.
We began by building trust with moms. They had the idea that they wanted to have dinner with some OB-GYNs from the community, those that they might see when they went to deliver. So the physicians got really excited about this opportunity. They got to spend time with women. They could educate them on the importance of prenatal care. And when they showed up and started, moms were like, time out. This is not what we had in mind. We just want to get to know you as a person, a human being. And so the physicians were like, oh, okay. So, they had dinner and they just got to know one another. Well, fast forward weeks later, one of our physicians walks in to deliver a baby, and immediately he recognizes the mom that is in labor. And he said her face just went from stressed to this calm, like, oh, I know this person who's going to deliver my baby, and I trust them to help me have a healthy pregnancy. It has to begin by listening to those with lived experience. And when you do, you can find new ways to remove barriers and address issues. One program we started to support this model was a maternal health law partnership. This allows women to get access to legal aid to help them remove health-harming legal issues, like access to food and issues with landlords and domestic violence. They serve as an aid and can reduce stress to, again, allow for a healthier pregnancy. We're helping moms with addiction. We started a new program that allows a mom who is addicted to move into First Step Home, that she's surrounded by the support she needs to fight her addiction, but her baby can come with her. Too often, we just take babies away from mom. And who does that help? This program allows them to stay together. And I was talking with a mom at First Step Home who said, I've been in treatment before, but this is different because I have little Mikey to live for. People just need access to supports, and we make it so hard for them. But if we think about how to surround them with these supports, they can engage in prenatal care, and we can decrease infant mortality, and even more, eliminate the disparity we see between Black and white babies. This community support is so important that with our partner Cradle Cincinnati, we created Queen's Village that brings strong Black women from the community together to support one another. So one can go to a appointment and be able to ask one of these women that they met and they trust to watch their baby for an hour. It's those social supports that are so important. And I've invited Meredith Shockley Smith, who is a doctor and works at Cradle Cincinnati and leading this Queens Village effort, to talk with us.
I am so excited to talk with Dr. Meredith Shockley Smith, a friend, a partner, who is Director of Community Strategies at Cradle Cincinnati, that is really driving and fueling the reduction of infant mortality. Can you share with us what is Queens Village? I know it's your brainchild, but can you kind of describe what it is and why it's so important?
The community said, I don't feel heard, seen, or valued. And my biggest problem with pregnancy and my baby up till 1 is that I am stressed to the max and I feel isolated, as if quarantine did not impact that enough. So that's what we went to work on, creating a strategy that helps them feel like we are hearing them. It helps women feel like the narrative is changing and that we are celebrating them. So we did lots of specific things, from the dinners that we shared to yoga and meditation for stress relief. And then the gathering together. So there are 2 kinds of gatherings. One is kind of across lines of difference, so that we're building empathy with the medical professionals and sort of looking at the wraparound program, so direct service of Cradle Connections and policy work. Last night, we were on a call and we were talking about Queens Village, and there was a queen who was on there, and she told her story about why she came to the village and what it gave to her. And so, in the beginning I had talked data. Like, I can tell you that infant mortality is down 18% in 2020, which was down from 2019, and we had been lowest. Exactly. So we are really having a great celebration right now. But I think that is the end-all goal, overarching. But when we think about public health, the fact that you are reaching women at a level of healing and emotional stress, that talks about sustainability of the work. It talks about lifting up leaders and creating systematic change in hospital systems. That's the story, I think, that for me gives me the most excitement, the most joy. She was like, I was at my worst. I had lost my job, I had 2 children. I was pregnant with my 3rd. I was having a difficult time with pregnancy, and I came to an event and someone got my number, and called me and followed up and said, how are you doing? And then came over, showed up. That's the work of a village.
In recent years, we've been able to spread this model and continue to do so, thanks to funding from Medicaid and HRSA. It is so important that we don't just create programs, but we work towards systems change. A great example of this is we partnered with Groundwork Ohio, and talking with OB-GYNs, we learned that many moms lose their Medicaid coverage 60 days after they delivered their baby. 60 days. I know I needed my physician longer than that when I had my 2 babies. So if we could just expand that to a year postpartum, we could address other underlying factors like maternal depression and plan for future pregnancies. So we partnered with Groundwork Ohio to advocate at the state to extend this coverage from 60 days to 1 year. Through advocacy, we were able to build in the money in the state budget. Now all Medicaid has to do is turn it on. It's so important that we address those system barriers so that we're all on the same playing field. I shared a lot of ideas with you today. I hope you are inspired to think differently, to try new things, to come together in new ways, and reach beyond hospital walls to partner with community and listen to those with lived experience. I want to inspire all communities to work towards that day where everyone can achieve their best possible health. Let's work like lives depend on it, because they do.